So my name's Esther Wakeman. I'm the Chief Executive of Leeds Hospitals Charity, and I'm really pleased to be joined today by Lindsey Burrow, who is my hero, also our patron and best-selling author as of the Sunday Times with your memoir, Take Care. Lindsey, it's so lovely to have the opportunity to talk to you about this incredible book that you've written, which really is a very detailed personal account of your journey, living with your husband having motor neurone disease. Is there anything you'd like to sort of start off telling us that really stood out to you when you initially thought about, oh gosh, yeah, this could be something that would really help other people?
Yeah, so I wanted to write the book. The name of the book is Take Care, and ultimately as heart at the care of the book, I wanted really to shine a light on the work that carers do, the amazing work that carers do. There are over 5 million carers in the UK that do what I did day in, day out, without the recognition, without the rewards, and I really wanted to shine a light on the work that they do and sort of champion and be an advocate for carers. It's also a huge celebration of Rob's legacy, what Rob achieved, throughout his incredible rugby career, and then also in his battle with MND, and then obviously right up until those very final few days, and doing the work around carers and trying to highlight the work that carers do. I just felt that actually if my story helped one of the person or family that was potentially going through a hard time, was experiencing loss, or just the emotional toll of being a carer, then that was the reason that ultimately I was inspired to do the book. I think he offered so many people so much hope and inspiration.
Yes.
And ultimately, I hope the book will shine a light on the work that carers do, but also show that no matter how hard life gets, there's always a way to keep going and to take care of the people that we love.
Oh, definitely. That really shines through in the book. And I think, as a family, you've done a huge amount to raise awareness of motor neurone disease. It's phenomenal, the fundraising that you've supported Leeds Hospitals Charity with to build the new centre in Rob's name. And I think that, a bit like motor neurone disease maybe wasn't that well known until Rob started raising awareness and all that you did. I think the same is probably true for carers. There's not a lot of awareness of actually how many people are there caring for their loved ones. When you say about how it resonates, I mean, I cared for my mum last year, and listening to the books, I downloaded it on Audible. I could really resonate with a lot of the things that you were talking about. And if I knew somebody that was about to start caring for a loved one, I would say to them, you've got to read this book, because actually it gives you the very raw and real account of everything that you go through. And I started by saying you're my hero, and I mean one of the reasons for that is I've got a daughter and wider family, and you describe your children, but I know whenever I speak to you, Lindsey, you're always busy. All your children are involved in different activities, and it is absolutely remarkable. So when you were caring for Rob, and that in itself is a full-time job, how did you take the time out to really make sure you were looking after yourself?
It's really difficult. I think as a carer, your sole focus is looking on the person and making sure, and I always said as long as Rob and the children were happy, then I was happy. So I never really thought about myself in that way. But for me personally, it was the running.
Yeah.
I was fortunate to run the inaugural Rob Burrow Leeds Marathon in 2023. I'd always wanted to run a marathon, and when it was announced that we're going to have the marathon in Rob's name, obviously I wanted to be on the start line and to raise money, again just doing a little bit for the Leeds Hospital Charity, for the MND Care Centre appeals. So running was a big headspace for me. It allowed me the time to just kind of focus on me and just put a playlist on, listen to a podcast, and just have that me time. And I've set myself a challenge. I'm gonna, I'm one of those people that if I say I'm gonna do something, I have to see it through. And I just wanted to make Rob proud ultimately.
What advice would you give to somebody who's really in the thick of it, looking after somebody, and they're feeling like, oh, I can't just take that time away? Because you do need to recharge your own batteries, don't you?
Absolutely, and I think it's so important that you look after yourself, because being a carer has a huge emotional and physical effects on your health, and we know that people that are carers are more likely to suffer health problems themselves. So I think what's really important is that you take that time, and I was so fortunate that I had the support of my NHS employer and family and friends. I was able to make that time, and without that those family bonds and that strength of family, I wouldn't have been able to do what I did. You know, they would help with the children. Rob's parents would help in caring for Rob. So it was a huge team effort.
You know, it's a real privilege to be able to care, as you've talked about a lot in the book. And what advice would you give to, you know, people who have a company and they think, well, I want to be able to make sure my staff are well supported? What sort of advice would you give to employers to help their staff that may be going through something like this?
Yeah, I think first and foremost, it's really important that, you know, you have those conversations with your employer so that your employer's aware of the situation, you know, the employer's aware that you may be a carer. And it's just talking through what options there are, because there may be times where you have to take leave from work to go to appointments, hospital visits, various things. So I think making the employer aware is really important, and, you know, having those discussions about potentially having time off work, flexible working, maybe reducing your hours is really important.
And then, you know, thinking about, you were saying, you know, there was always people on hand to help. And I think sometimes people worry about asking somebody else to help. But I mean, I know in my experience, people actually liked the fact that you asked them to help. So what advice would you give to you know, people that either are friends of somebody who's caring for a loved one, or the carers themselves, of how to really lean into that and get everyone to help where they can?
I think it's really important to check on your friends and people that are carers, and you know, whether that's you know, a phone call, visiting, just actually making sure that they're okay, and you know, asking them the question, are you okay? Is there anything I can do to support you? Whether that might be just going to get the shopping, you know, simple things that we take for granted. You know, my advice would be take all the help you can get and communicate. You know, don't get to the point where it becomes a crisis.
And that's something I found reading your book, was that sense of, you know, really understanding that somebody else has been through that, and you know, some of the really honest and very detailed accounts that you've put in there, I think really would help somebody who's maybe, you know, just started caring for a loved one and doesn't know what to expect. But the other bit that I found, you know, you were so honest and really helpful, was when you were talking about, you know, the final days in hospital, and, you know, the care that you took with your children. Because I think that's often as well something people really worry about, what to say, what not to say. And it felt like you navigated that brilliantly, although I don't know if that's how you felt at the time.
No, I think there was huge mum guilt, you know, and lots of time that I'd, you know, researched on the internet. You know, I'd been on like the Child Bereavement UK sites, and just, you know, I'd never had to deal, you know, the children really had not experienced death, and to experience the loss of the dad was a huge thing. And you know, nobody ever expects to be in that situation where you've got to tell your children, you know, that the dad is you know, so critically ill in hospital, as we had to do with our children. And yeah, it's really tough. I think we decided from very early on in Rob's diagnosis that we were going to be honest with the children. And I think we kept that promise to them, to be honest. When Rob was first diagnosed, we talked about how, you know, the doctors and nurses were doing everything they could, you know, for Daddy. But we were always honest with them, because I never wanted the children to look back and say, but Mummy, you said Daddy was going to get better. I remember on the day of the funeral, Macy saying, Mum, why did it have to be my dad? And you know, that was a really difficult conversation, because, you know, I just, how do you answer that question? But I just said to look at what Daddy's done, look how many people that he's helped, and, you know, I hope in years to come, you know, I know how proud they are of their dads, but I hope in years to come they will take comfort from that, and, you know, just the incredible work that's been done around the awareness, the fundraising. You know, we've got the M&D Care Centre that's going to open, you know, later on this year, which is so exciting, and, you know, to have that centre, and for it to be a place where we can go as a family and remember Rob. And, you know, I just think the hope that it will give other families that, you know, that are in our shoes, that, you know, we're going to get that diagnosis, and it will really make a difference.
Lindsey, in your book you talk a lot about how amazing Dr. John was in the care, and I remember the first time I met you and Rob, and I think it was it Macy? You came into the centre at Seacroft. And we were talking about how important it was to have a new centre. And the first thing you said was, well, you know, I wouldn't ideally bring my children in here. It's, you know, very clinical setting, not ideal. And actually that's a massive big deal to somebody who doesn't have the support network. And I know that that was something that was very much at the heart of your desire to fundraise for the new centre. So can you talk through just some of the challenges around, you know, the current centre and why it was so important to fundraise for the new one?
Yeah, so the current centre at Seacroft is very, you know, it's on an old infectious disease ward. It's very dark in there. There's not much light in there. The car park seems miles away from actually, you know, getting into the building. And a lot of patients with MND have mobility issues, so you know it's not always easy from getting to the car park actually into the building. The building isn't built for people with MND, so there's accessibility is an issue. When you go to an appointment with an MND, you often see a range of specialities within that appointment. So you might see, you know, the consultant, the physiotherapist, the occupational therapist, speech and language, and actually you can be there for a good 2-3 hours at a time. And I think often we felt quite drained coming out of there because it was so dark and there was no light and it wasn't a place, you know, nobody looks forward to going into hospital. But I think to have a centre where, you know, you don't have to worry about taking your children because there's facilities there that, you know, will keep the children entertained, and, you know, there wasn't the space, there wasn't the accessibility. It just wasn't a pleasant experience going in there, and that's not taken away from the clinical care. The clinical care, you know, is world class, and Dr. Jung and her team do an amazing job, and, you know, patient care is at the centre. But I think having that specialist care and being so good, it needs to be in the right environment, and it's just not fit for purpose.
So I know when I watched the documentary, one of the documentaries with you and Rob, I was really taken by how small the consultation room was. And I remember Dr. John saying to me, you know, imagine giving, you know, the absolutely heartbreaking news to somebody that they have got motor neurone disease, and it's in a room like this. And I think that was what really struck me when I came and met you and, you know, looked at the space that there was and thought, yeah, I mean, this isn't, you know, somewhere that people are in and out of. You know, it's a long time that you're coming in and seeing people in the centre. Oh, you know, every time you've got to come, there must be an element of trepidation about the parking up, the long walk. And I guess as well, you know, there's a point in time between somebody being able to walk and then needing to use the wheelchair where it's a long way, you know, from the car park to the treatment rooms.
It just adds to the anxiety of the whole experience. And I think actually, like you say, you worry about actually you know, before you've even entered the building, you're worried about parking, you're worried about accessibility, you're worried about what, you know, what you're going to do with the children, how you're going to get into the space, and then to come out and just feel so drained afterwards because you're in a small pokey room, and that's where you spend most of the time. And also the thing that, you know, on a personal level was when Rob was diagnosed, we had to walk back out through the waiting room. So we were, I think, first on the list of that appointment and had to walk through a waiting room full of people having just had the devastating news. And, you know, it just felt like the whole world's eyes were on you, and obviously nobody knew the diagnosis at that point, but that was really, and what the centre, you know, things like that, we've considered the factor, so actually they will be able to go out in a different way. They won't have to walk through, you know, a waiting room that's full of people waiting for their appointments. And some people want to see that and some people don't, because people are different stages of the journey, and for some people that might be helpful, but somebody that's just newly diagnosed might not want to see somebody that's at the end of you know, the stage of the disease. So what the centre has done is it's taken all those things into account when designing the centre, which will make a huge difference to families, and it just shows how, you know, how well it's been thought of and how much patient care is at the centre of the centre.
Absolutely. And like you say, the actual care that's delivered is world class in Leeds. And, you know, Dr. Jung has been a really positive force in driving this appeal, and I'm pleased, you know, we hit the 6.8 million last year, and, you know, we're going to be opening the centre later this year. I'm hoping that you will be there to cut the ribbon. And you know, it is going to be a fantastic achievement, I think, for the whole community, because it has been a real community effort to raise that money. You know, when we think about the number of people that, you know, sent in £10 with a, you know, a lovely letter explaining why they'd made that donation, it will be a centre that's really been built with love from local people. And, you know, I think one of the things as well we've seen is the spotlight then, you know, on Leeds and opportunities that have come out of that, because, you know, research is obviously a key thing that we want to be able to support, and that wouldn't have happened without the spotlight that has come from building the new centre. So, I mean, how does that make you feel to know
Well,
that
you
you've
probably
been
can see I'm
part of
sat
that?
here with a big smile on my face, just sort of nodding away, because I feel immensely proud. And I think, you know, this wouldn't have happened without Dr. Jung, you know, sitting down with us. Only 3 years ago to have that conversation. You know, I think we should build a centre, and you know, it was her vision to build this specialist flagship centre in Leeds, and I think it's just, you know, hopefully this is going to be the first of its kind. I hope other centres will, you know, come on the back of this, and I think, like you say, the opportunities for research is really going to give people hope, because the reality is at the moment people have to go to Sheffield, they have to go out of area if they want to be involved in research trials, because they're not offered, you know, here in Leeds. So I think to have that, you know, as an option in the future is going to be fantastic. And again, it's going to give people hope. It's going to give them real, you know, optimism for the future. And I think it's just incredible, and we feel so honoured and privileged and fortunate as a family to have the centre in Rob's name. It's a, you know, huge privilege, and somewhere we can go and remember Rob in the future, and go there as a family. And you know, I'd like to be involved in the centre, and you know, continue with the fundraising, and come and help, and you know, volunteer at the centre in the future, because I think it really will make such a huge difference to families.
Definitely, and I think volunteering is a big, you know, part of what we do as a charity. We recognise there are multiple opportunities, you know, with the centre, but also in other parts of the NHS where people can give up their time and really help make a difference. Being able to shine a spotlight on motor neurone disease, and you've said all along, you know, you're not the only ones. There are other people, and sadly, it is, you know, a cruel illness that people live through. And you were one of the families that were happy to share your stories as part of our 7 Stories awareness campaign. And there were, you know, a number of other families that you met as part of that, and I think they've all been part of fundraising in some way, shape or form. How did it feel to sort of see that your initial support for the appeal then encouraged other patients with motor neurone disease to get involved in either raising awareness through sharing their story or fundraising?
It was really heartwarming, and I think to hear other people's stories and the challenges and the things that they faced, it brings it home, but it also makes you feel that you're not alone. And I think people coming forward and sharing their story and their fundraising efforts, you know, it just kind of gives you that glow, and kind of, you know, nobody wants to be part of the MND community, but what a beautiful community it is. And I've met so many wonderful families and people that, you know, that have inspired me to keep going. And, you know, when times are tough and you look at what other people are going through, and I always used to say to myself, there's always somebody worse off than yourself. And to meet those families and to hear their stories, it really hits it home. But that's ultimately why we wanted to share our story, was because for those people that don't have a voice, for you know, the postman, the school teacher, the bricklayer, whoever that might be, was really just to raise awareness for those people. But to hear other people's stories and for them to be involved as well was brilliant.
And did you get a sense of that when you ran the marathon, that all these people were coming together because they wanted to do something for the MND community?
Absolutely. I think it was, you know, prior to, you know, Rob sharing his story, and the likes of the late Doddy Weir and, you know, Ed Slater, Stephen Darby, Marcus Stewart. I think people often forgot about MND, and I think it's been largely underfunded for so long now. But what Rob has done, and the likes of Rob, is by sharing their stories, the awareness now, people now know what MND is. And, you know, I think before people were quite ashamed, and they wouldn't go out, they would hide away, and I completely understand why they would do that. But actually now it's about saying, well, no, you know, you don't have to hide away. And I think that's one of the things, you know, that the awareness that's been raised now, people now know what MND is. And, you know, for me personally, to have people say, we don't have to explain now what MND is, because people know what it is. And Dr. Jung often says she has people come into clinic and say, I think I've got the Rob Burrow disease. So to have that effect, and for people to recognise the symptoms and get tested earlier and be diagnosed earlier, is going to have a huge impact.
Absolutely. And, you know, the people who got behind with us with the fundraising. So, you know, the postman, the bricklayer, you know, all these people. I mean, what would you like to say to them?
Just a huge, huge heartfelt thank you. You know, without your support, this centre wouldn't be happening. We have raised over £6.8 million now, which is incredible, and I think it's just a real reflection on the community spirit, and I think how much people meant to him. But just thank you so much. You know, without you, we couldn't have done this. We couldn't have achieved what we've achieved, and it really will go on to help so many families in the future.
Thank you, Lindsey, and I'm sure they would say the same to you, that this wouldn't have happened without you opening up your life and letting, you know, the BBC, obviously huge supporters of the appeal and helping to raise awareness of it, and we wouldn't have been able to raise this phenomenal amount of money if it hadn't have been for you and you know, all of your children as well. They're so wonderful in how they've got involved in the fundraising, so we really, you know, thank you from the bottom of our hearts, Lindsey, for all that you have done and all you continue to do. Thank you.
Thank you. Thank you.